Thank you so much for joining today's Policy Spotlight. We're just going to give it 1 or 2 more minutes. We know that we're still admitting a few more people into the waiting room. But we wanted to take time to just thank everyone for joining today's session. It's great to see so many familiar faces and some of the other faces who have joined in our previous calls. Just to introduce myself, my name is Armini Pierre-Jacques. I work as the Community Health and Policy Associate at the New Jersey Healthcare Quality Institute. And I'm also joined by my colleague, Kate Shamzad, who will also introduce herself.
Hey everyone, I'm Kate Shamzad. I work as the Director of Policy alongside Armini at the Quality Institute. Good to see everyone today.
Great. So if you're unfamiliar, just to provide some background, this Policy Spotlight is being hosted by our Maternal Infant Health Hub, which is a learning collaborative that was launched by the Quality Institute and also the Brick Foundation. And the main goal of the Maternal Infant Health Hub, or the MIH Hub, you'll hear us use that abbreviation for short. Our main goal is to raise more awareness and to amplify midwifery practice in New Jersey. So we host these policy spotlights just to give an opportunity for deeper dive into research and just to provide an overview on specific policy related issues that will impact midwifery. We also host midwifery collaboratives as well, which just serves as a convening for midwives, midwifery students, and other healthcare stakeholders to come together and to discuss specific midwifery issues in a very interactive discussion. So for today's session, for our policy spotlight for today, we are going to focus on New Jersey's proposed fiscal year 2024 budget and also the Medicaid 1115 waiver, as well as provide an overview on state and federal legislation that is very key for midwifery and maternal infant health today. And so you'll hear from our speakers, Kate Shamzad, Ariel Elias, Julie Blumenfeld, and then also Jill Watnick. Please know that we will also have a brief Q&A at the end of our program. So please be sure that you are sending in your questions into the chat box, or you can also private message them to me throughout our session so that our speakers can address them at the end of the program. We will also have a Jamboard running for you in the background. The Jamboard will be a space for you to just post any of your thoughts and your reflections as a way that you're to digest any of your thoughts throughout the content that you're going to hear today. So please feel free to post your thoughts and anything that is currently resonating with you as you hear all of the speakers' presentations. The link to the Jamboard will be posted on the chat momentarily, and we'll be sure to visit that at the end of our program. And finally, please note that after today's session, once you leave this meeting, you will be asked to take a very brief exit survey. And that exit survey is just going to assess your knowledge in midwifery after attending this session. And we're going to use that feedback to inform a lot of the Maternal Infant Health Hub's work moving forward. And again, if you'd like to introduce yourself in the chat, you are also free to do so with your name, your organization, and your role. But with that said, I will hand it over to my colleague, Kate Shamzad, to begin today's program.
Hey everyone, it's great to be with you today and see so many familiar names and faces. I'm going to try to be the shortest part of today's program. And so as Armini's loading my slides, I'll just give you a bit of an overview. You're going to hear mostly from our other speakers to learn about both state and federal legislation that is impactful for the maternal child health period, but also for midwives working in New Jersey and across the country. I wanted to just give you a little bit of background to talk to you about sort of how the kind of life cycle of budget and Medicaid works in New Jersey, just to give you a little bit more knowledge as you're learning about some of the legislative efforts that are going forward. So with that, I'll just jump right in. Armini, can you go ahead a slide? So just to level set, obviously we all know we've been living through a really crazy time from a healthcare perspective. And while we seem to be coming to the end of it, at the end of the public health emergency, which ended officially in April, that does have a lot of implications for sort of how healthcare and Medicaid is working in the state of New Jersey. So we wanted to give you just a little bit of an overview about that. So basically, during the public health emergency, in order to make sure that people could access the care that they needed, including pregnant people and children, the federal government allowed Medicaid to keep everyone who was enrolled in a state Medicaid plan on Medicaid. So instead of every 6 months having to redetermine eligibility for the program, or in the case of children, every 12 months, basically Medicaid in New Jersey and across the US did not disenroll anyone. And so what that means is that we went from having about 1.6 million people in Medicaid in New Jersey at the start of the pandemic to now having over 2.3 million people. And as a result, New Jersey, now that the public health emergency is over, has to determine the eligibility of each one of those 2.3 million people over the course of the next 12 months. So what we would expect, and why I'm telling you this, is that that's going to be a significant hurdle, both for the state to have to do that, but also for individuals who are on Medicaid to be aware and watching, their communication. All of this information is going to come through the mail to them. But it does mean we'll see significant fluctuation in how many people in the state are enrolled in Medicaid. And it also means that people may inadvertently find themselves without any healthcare insurance if they weren't able to, if they didn't complete their Medicaid re-enrollment, or they are no longer eligible for Medicaid. So this is an issue that we're watching. And of course, at future collaborative meetings, as it's interesting to you, I'm happy to report back. But this process began in April, and it will continue to go forward over the next 12 months. Next slide. Also, to level set, I wanted to give you a little bit of an overview about what budget season looks like in New Jersey. I was really hopeful that I would be able to come today and share with you the budget and what was expected to be voted on to start the fiscal year 24, which begins on July 1st. Unfortunately, the budget is not out yet. It has to be voted on by the end of June by the full legislature in the state. So we're expecting the budget to be released later today or tomorrow. So unfortunately, I don't have a lot of updates for you, but I did want to give you just a glance at what this kind of cycle looks like. So in February, the governor puts out his full budget, and it basically says, like, this is what the governor proposes as in the state budget for the year. And at that time, over the course of March and April, every one of our state departments basically goes before the full legislature and talks about their budget, answers questions people might have about how their spending was in the previous year and what the future year looks like. And then in April through June, while the budget's being prepared sort of behind the scenes from the legislature, regular session goes forward. So I'm sure you'll be hearing from Ariel and Julie a little bit later about what's happening within state legislature, but that's happening at the same time the budget is being put together. Then in June, the Legislative Appropriations Act, which basically is the budget, what the state will use for all their funding beginning July 1st, has to be approved by June 30th to avoid government shutdown. And so we are on track to have that happen. And then this year's a little bit different from a government perspective, and it's just worth noting because it impacts how legislation sort of moves through. But New Jersey's a little wacky in their terms, and this year everyone in both the Senate and Assembly for the state is up for re-election. So that means 120 seats have to be re-elected. So there's could be new seats, could be incumbents, but it basically means that every seat is going to be voted on. So that happens in November of this year. And then if anyone has ever heard the term lame duck or knows what it means, basically the period of time when elections are complete to when new legislators are brought in officially is called lame duck. And it means often there's a lot of interesting things that happen, either pieces of legislation that hadn't moved before get introduced and could go through sort of legacy projects from senators or assembly people who are on their way out, or special projects could be introduced at that time. So that's called the lame duck session. And then everything starts over again the following January. So just wanted to give you that context for the discussions today. Next slide. And then lastly, just wanted to give you a little bit of an overview about New Jersey FamilyCare and policy levers, 1115 demonstrations specifically, because I know that number has been thrown out a lot lately and people are probably kind of confused about what that means. So I'll skip over this slide because it's going to be sent to you later in a PDF, but really talk to you specifically about 1115 waivers. So what 1115 refers to is the Medicaid law from the federal government. 1115 is the section of code that prescribes what Medicaid can do within states. And so ultimately, our state, if they want to test something new or try something new within our Medicaid program that's not generally permitted, they apply for an 1115 waiver to CMS. That's the Centers for Medicare and Medicaid Services. They basically federally govern how the Medicaid programs work within the states. And so under 1115 waivers, the state can do a few different things. It can provide Medicaid support and services to a particular population, like pregnant individuals. It could provide support to a particular part of the state, potentially the southern counties or urban versus rural. It can also think about how to provide healthcare in a different way, perhaps outside of the walls of a clinic or a hospital. And it proposes how to do this in maintaining cost neutrality. So basically saying to the federal government, we want to try something, it's not going to cost you more, and we'll measure and show how it impacts our individuals who are on Medicaid. Next slide. The state goes through this process of an 1115 waiver every 5 years. So we're on currently our third waiver. The first one was in 2011 and it lasted for 5 years. And then instead of putting in a complete new waiver each time, the state does what's called a waiver renewal. So some parts might stay in and some parts might change, basically with the state saying, we'd like to try these new programs. Ultimately, the people on this call, myself included, can have a lot of say in what happens in this process and what we choose to focus on from a state perspective. And that process usually starts about 2 years before the Medicaid renewal is even due. So this is a timeline basically showing that public listening started in November 2020 and the waiver was approved in March of 2023. So you can see there's a long lead up to how these are put together. Next slide. So this year, Medicaid in New Jersey focused on a few things, and I think it's really important for us to talk about. We can talk in just briefly today, but then also in more detail in another date. But this year, Medicaid was really focused on thinking about health beyond just your traditional medical care and really thinking about how there are social implications of the healthcare that's provided. And so the thought really was, how do we use community support and all of the other levers of care to ensure health of people who are enrolled in Medicaid? So if you go to the next slide, I'll tell you a little bit about some of those programs that were included in 1115 waiver, specifically that impact the perinatal care population. First and foremost, I think everyone probably knows, but about 1.5 years ago, the state increased the length of time that someone can remain on Medicaid after they had a baby for 12 months. So it used to be 2 months, but now it's extended to 12 months. And that's included in part of the waiver because that is care for a specific population that's not extended to everyone in the state. So it has to be part of our 1115 waiver. So that's an example of how you would use a waiver like this to provide additional care. Additionally, this year's 1115 waiver included housing support. It's going to allow Medicaid dollars to be used to allow people to find safe and affordable rentals and then maintain those rental agreements, including making modifications to housing as necessary to stay safe and healthy. It also includes a community health worker pilot that will be part of the managed care organizations rolling that out, and that allows them to focus on specific communities. And it also would include nutritional services. So making sure that, for example, a pregnant individual who had gestational diabetes may be able to get medically indicated meals delivered to their home to help maintain their health and control their diabetes through their diet. In addition, like I said before, it also includes that 12 months of postpartum care for someone on Medicaid. And lastly, it allows for those on Medicaid, adults on Medicaid, to be continuously eligible for 12 months instead of having to re-enroll in Medicaid every 6 months. This allows significant flexibility because we know people who are on Medicaid tend to have what's called churn. They leave Medicaid because of their salaries, but then need to re-enroll because their income levels change. And so having 12 months of care allows you to access care throughout that whole time that you need, even if there are slight variations in a family's income. So lots of really exciting things are happening in the state right now in regard to Medicaid and the 1115 waiver. I know I probably went over my time, but there's always a lot to talk about. I'm going to stop now and I'm happy to answer questions later, but I'm going to hand it back to Armini to introduce our next speakers. Thanks for letting me give this little overview.
Great. Thank you so much, Kate, for providing that overview. We will now transition over to Ariel and Julie, who will be our next speakers to introduce themselves. To introduce them, Ariel is a certified nurse midwife at St. Peter's University Hospital in New Brunswick. She received her undergraduate degree in public health with a focus on maternal health policy from Rutgers University in 2014, and her graduate degree as a midwife in women's health nurse practitioner from Yale University in 2019. Ariel serves as the legislative chair for the New Jersey affiliate of the American College of Nurse Midwives, and she is passionate about providing patient education, supporting patient autonomy, and expanding options to evidence-based care. And we also have Julie Blumenfeld, who is also a certified nurse midwife and fellow of the American College of Nurse Midwives. She is a clinical assistant professor and program director of the nurse midwifery and dual women's health / nurse midwifery programs at Rutgers School of Nursing. She is the chair of the New Jersey Maternal Care Quality Collaborative and serves on the New Jersey Maternal Mortality Review Committee and the New Jersey Board of Medical Examiners Midwifery Liaison Committee. Dr. Blumenfeld is active in the American College of Nurse Midwives at both the local and national levels and is a passionate advocate for creating lasting change through health policy. And so with that said, I will now introduce them to speak on their overview on New Jersey state legislation that focuses on midwifery. And with that said, I will also share their slide deck.
Okay, perfect. Thanks, Harmony. Perfect. Excellent. Okay, so thanks so much for having us here today. And I will say, unlike Ariel, I definitely did not have any background in this area. I've been a clinical midwife for over 2 decades. And you know, when you realize you have an opportunity, it's important to take advantage of it. And I'm all for advocating for midwifery and for increased public access to the care that we give. So the story begins, you know, it's funny, we talk about elevator pitches, but my story and my engagement in policy in New Jersey really did begin actually in an elevator. I had been involved in advocacy work for doulas in New Jersey, something that's really important to me. To collaborate with my doula colleagues. I was at the bill signing for the Medicaid to include reimbursement for doulas in New Jersey. And I somehow just felt a little frustrated that midwifery really wasn't a big part of the story. Although I do strongly feel that it would have evolved that way regardless. Nevertheless, I saw the First Lady's chief of staff and policy director in an elevator in a parking lot, and I ran literally to catch up with them, introduced myself in the elevator, gave them my card, and our relationship began. Next slide, please. So this photo shows my first official meeting, first of many meetings with the First Lady's staff and our interactions with them. And certainly this administration and Tammy Murphy and her staff in particular have been tremendous advocates of midwifery. And our legislative committee in the affiliate has made up of super busy and committed group of clinical midwives who've really stepped up to try and advocate for our profession in this administration, who's really interested in moving the needle on improving maternal health outcomes in our state. Next slide. So I'm sure you all are familiar by this time with the Nurture New Jersey strategic plan that the Hurd administration developed to improve maternal health outcomes and really became a roadmap for improvement for perinatal outcomes in our state, particularly for Black women in New Jersey. And we were included in many areas in this document. Really, we leveraged the opportunity for midwives to be seen as part of the solution for the issues we were facing. And the voice of midwifery was included in this plan, and we can see has led to really concrete changes. Next slide. So I'll just walk you through a little bit of how midwifery was included in this document. When they talked about shifting ideology and mindsets to increase support for transformational action, things that were called out, we're developing a communication plan to promote the benefits of midwifery and for community doula models in order to strengthen and expand the practice of midwifery model of care in New Jersey to build a more robust workforce pipeline. And so when you look at things like creating incentives for hospitals to serve as clinical sites and potentially requiring midwifery graduates who receive state funding for education in high area needs in New Jersey, these specific things haven't happened. But as Ariel will point out, when we talk about, what great things have happened, is there has been significant funding for midwifery education that has led to efforts to investigate barriers to the expansion and diversification of midwifery in New Jersey and help provide greater opportunities. Next slide, please. Additionally, mentioned in the Nurture New Jersey strategic plan specifically was that all women or birthing people should have the option to choose midwifery care, and the midwifery will be available and fairly compensated. And again, when Ariel speaks to the specific of what's happened, you will see that this definitely has been a change that's been put into place. Things are moving along, and we are now compensated equitably for the work that we're doing. The called out was, next slide, please. Medicaid increasing the certified nurse midwife rate to the equivalent of 95% of the current physician rate. And so we see this first step, right? So this was the first step. The Nurture New Jersey strategic plan talked about increasing rates. And we saw that in 2021, the rate was increased to 95% of the physician rate. And we now know that is now, the needle has moved on that. And now we are reimbursed at the same rate as physicians under fee-for-service within Medicaid. Next slide, please. Another thing that we saw huge accomplishment is that the New Jersey Department of Health reviewed the rules about midwifery practice, and certified midwives who have the same training as certified nurse midwives to provide midwifery service had huge barriers to entering hospital systems and had to have a waiver in order to be privileged within New Jersey hospitals, despite them having the same certification and education as certified nurse midwives. And the rules were amended, and certified midwives are now permitted to provide those same midwifery services as certified nurse midwives within hospital systems. Next slide, please. And so the last accomplishment that I will mention about midwifery in New Jersey was a waiver recognizing the practice of certified professional midwives so that they could attend births in birthing centers, again, increasing access for the public to the midwifery model of care. And now I'm going to turn it over to Ariel to continue to talk about what we've seen as accomplishments in New Jersey.
Great. Next slide, please. Thanks, Julie. In December 2021, the Board of Medical Examiners adopted new rules that allow non-physician providers to provide abortion services in New Jersey. So certified nurse midwives and certified midwives are trained in medication abortion and can receive training in procedural abortion under our scope of practice. So this change in the rules not only expands access to midwifery care and assures continuity of care for midwifery patients, but also increases access to reproductive health options for the public. Pictured below, in November 2022, the American College of Nurse Midwives New Jersey affiliate hosted a workshop open to all midwives in New Jersey to refresh medication abortion and manual vacuum aspiration skills. Next slide, please. In the 2023 fiscal year budget, it included $1 million for midwifery education. These funds were awarded to the Rutgers midwifery program. Pictured on the right is a new Rutgers grad was invited to the press announcement to talk about this funding. These funds were used for developing sustained funded clinical site placements, research about barriers and facilitators to placing midwifery students in clinical settings, a full preceptor workshop series, and develop a state-of-the-art simulation center for the state of New Jersey. Hopefully, there are more funds for midwifery education in the draft budget for 2024, and then we will see, what is going to happen. And this funding will go towards everything I just spoke about, and will also include student scholarships. This is really important because because Rutgers University College in Newark is the most diverse university in the country, and the midwifery program is one of the most diverse midwifery programs in the country. So by supporting midwifery students in New Jersey, this funding will not only expand the workforce, but support diversifying the workforce and creating providers that reflect the birthing people in New Jersey. Next slide, please. In January 2023, the New Jersey government increased reimbursement rates for midwives to 100% of the Medicare rate. So as Julie mentioned, they were increased to 95% of the physician rate earlier. And this increased to 100% of the Medicare rate. Now, according to the Medicare rate, midwives and physicians receive the same reimbursement for all the same services, including obstetric and gynecological care. So this was in essence pay parity for fee-for-service Medicaid. This is really important for increasing access to midwifery care. This equity starts to dismantle the artificial hierarchy that exists amongst obstetric care providers that often is one of the barriers to midwives taking care of their patients. So this will improve that access. Next slide, please. So these are the bills that I wanted to highlight that are currently pending in the legislative session. There are a couple at the top: Assembly Bill 804, Assembly Bill 817, Assembly Bill 1991. Oh, that should say S2574. All of these are great bills that would increase access to midwifery care in various ways. They were introduced. So Assembly Bill 804 was introduced in the Assembly in January 2022, and it's still in the Health Committee. Assembly Bill 817 requires health insurance carriers to cover home birth. Was introduced in January in the Assembly only, and Bill A119 S2574 requires the Commissioner of Health to establish a public health campaign, which would bring awareness to all types of healthcare providers that provide obstetric care, to doula services. And this was introduced in February and March 2022 and has not made any movement. Of note, Assembly Bill 4223 and Senate Bill 2792 were both introduced June 2022 and have had a lot of movement in the past month, this in June 2023. So both of these bills will increase the Medicaid reimbursement rate for primary care services, which includes obstetric and gynecologic care. So earlier in January 2023, when the reimbursement rate for midwives was increased to 100% of Medicare, that was for fee-for-service. This is for the MCOs under Medicaid. So this would increase the rate to be 100% of the Medicare rate for MCOs and Medicaid. So this got out of committee in January, and hopefully it will get voted on, June this month, and hopefully it will have a vote shortly in the General Assembly and the General Senate. The last bill down here, Bill A5472, and in the Senate, the Bill 3864 establishes New Jersey Maternal and Infant Health Innovation Center. This establishes a health innovation center located in Trenton with the purpose of coordinating care for best practices in New Jersey for maternal health. The goal is to be an academic research and workforce training center, and specifically calls out increasing and training the midwifery workforce. Next slide, please. And some upcoming legislation that I'm sorry we don't have a bill number yet, but it is, hopefully we'll have a bill number today or some point this week when it is introduced. The Senators Vitale and Cody and Assembly members Timberlake and McKnight have been working really hard on a bill to modernize the current Midwifery Act, the midwifery statute. The current midwifery statute was created in 1892. That's what we have on the books. Our laws are from 1892 and has had minimal updates since that time. Sorry. This bill will update these antiquated regulations and modernize the practice of midwifery and expand access to evidence-based care. And the bill would do two things. One, it would create an independent board of midwifery, and two, would allow certified nurse midwives and certified midwives the opportunity to prescribe without restriction of a collaborative agreement with a physician. Currently, midwives are regulated by the Board of Medical Examiners. This bill would create an independent board of midwifery made up of a majority members of midwives. This will ensure the practice of midwifery is overseen and regulated by the professionals that are experts in their fields. Currently, midwives in New Jersey may practice independently according to the law. However, only certified nurse midwives right now may prescribe, and they must do so under a collaborative agreement with a physician. certified nurse midwives and certified midwives are trained to practice and prescribe independently. This bill will allow certified nurse midwives and certified midwives to practice to the full extent of their training and to the full scope of their practice. There are already 31 states that have independent prescriptive authority for midwives, including our regional counterparts, such as New York and Connecticut. In this aspect, New Jersey is behind. We have an abundance of data that shows that in states where midwives can practice to the full scope of their training, there are more midwives, and where there are more midwives, there are better birth outcomes. So please keep your eyes out. We'll send out an announcement to everyone we have on our list when this bill is dropped, which will hopefully be today or some point this week. We were really hoping to announce it today at this meeting, but it's coming. But this is just one of the many fantastic pieces of legislation that are out there that will increase access to midwifery care for the public. Thank you, and let us know if you have any questions.
Thank you so much, Ariel, and also Julie, for providing that overview. I think that sets up the stage nicely for us to hear from Jill Wadnick, who will now present an overview on federal legislation.
Thank you so much for having me here today. And these conversations I love coming to, because not only do I get to see colleagues and friends from all over the state, but the information is always so timely. So thank you so much for having me here. My name is Jill, and really hope that we can contribute to expand this conversation. And I'll be looking at maternal health legislation with a focus on midwifery from the federal level perspective. But I'm going to start with the humility that birth in the United States is a complicated issue. And this is defined by Motherboard. This infographic is a few years old. But nevertheless, it gives us the opportunity to breathe in to the dichotomy of what consumers experience, what healthcare providers experience, and the urgency of reimagining equity within maternal health. I'll also just direct this conversation and frame it through the landscape of Dr. Deborah Bingham, using her PQI factors, the society factor, the community factor, relationship, and individual factors, all of which have to be addressed. And so as we sit and breathe with what could be an overwhelming way of how do we begin to transform, one of the levers that becomes really important is the role of federal legislation. I defer to the March of Dimes, who has a really sweet hashtag, blanket change. And they remind us that we can tell a different story about maternal health equity through focusing on policies and making sure that those policies have funding and legislation for sustainability. And at the end of the presentation, you'll get links to all of those, but I'm going to use the words of the March of Dimes that remind us that policies really further equity, access, and prevention. And really looking that as a lens within maternal health helps us understand where we are. So consumers, policymakers, and anyone else may have seen recent national news. This past April, and this is just a snapshot of a couple of national news landscapes. I could have had 100 if I did all the different regional ones. Maternity care deserts really were getting much more visibility. Again, there was a March of Dimes map that came out in January and that gets updated every 2 years. But this past April, a lot of media outlets were really looking at this topic about maternity care deserts, the workforce shortage in maternity care, and then making some regional priorities emerge. Also this past April, what was really interesting in terms of federal levers with midwifery and maternal health is that the United States Government Accountability Office did a report on midwives. And the reason they did this report is that congressmen and women requested it. That's how the GAO works, that they put together resources and reports at the request of Congress. So it's just interesting to take a look. I have a screenshot of the different representatives that requested this report. And this report really becomes important to fuel the important needs assessment and the data about why we need federal legislation on maternal health and specifically midwifery. So here's a couple of snapshots. Data shows that in 2021, and this is at the national level, 12% of births were attended by a midwife. But they really found those challenges for consumers to provide to access midwifery care, and for healthcare providers who wanted to go into the midwifery pipeline to get that workforce. And although this is national, we know that this is somewhat similar data in New Jersey. It's about 10% of individuals in New Jersey give birth with a midwife. And we know that really making sure that we continue to attract a diverse, inclusive, sustainable workforce is really important. So these are some infographics, and the report will be listed. You can go to the report. I have that at the end of the presentation, and it's worth adding to your summer reading, partly because if you were on the New Jersey Healthcare Quality Institute last week, I heard a wonderful presentation from 3 different scholars about CNM, CM, and CPM educational pathways. And that really helps understand this report in terms of this report nationally looks at the different pathways in terms of students who are enrolled in CNM, CM, or CPM. And then they also talk about the current number of midwives and the current number of students. And they also, again, have a chart really documenting state licensure, the birth setting. And I just want to say this came out in April, and CPMs were listed as having licensure in 36 states, but actually last week, Iowa is now able to license CPM starting July of 2024, a year from now. So that'll be increased to 37. So what do we do with this information where we have this needs assessment of obstetrical deserts, the urgency of consumers wanting midwifery, and the need to increase and retain a diverse workforce? Well, that was part of the first piece of legislation that got introduced, actually reintroduced just on June 1st. So when Kate and Armini emailed me about doing this presentation, it was literally the same day that the Midwives for Moms was on the floor. So this is not the first time that the Midwives for Moms has been submitted as a bill to Congress. It's bipartisan. And on the right, I put a little infographic from social media that NACPM they were really excited also on June 1st when this came in. So now we're in the 118th Congress. This is bipartisan legislation, and there's both a House and a Senate version. And I want to take a moment and just explain and really talk about the current legislators that are supporting Midwives for Moms. So Representative Ashley Hinson, who's from Iowa, and our own from New Jersey, Representative Bonnie Watson Coleman, reintroduced the Midwives for Moms Act. And we also have Senate counterparts of Senator Ben Ray Lujan and Lisa Murkowski. And this is important just to recognize when it was previously in the 117th Congress, it was introduced by 2 previous maternal health champions that were in Congress from California, Congresswoman Roybal Allard and Representative Jamie Herrera Butler. But Representative Roybal Allard, she retired. And it's interesting, Representative Herrera Butler, she was a Republican, and she was one of the 10 Republicans voting to impeach Donald Trump after the January 6th United States Capitol attack, and she did not win re-election. And so people who were following the Midwives for Moms were really curious, was this going to be able to get bipartisan lifting in both the House and Senate? Because those 2 previous congresswomen had really been champions of it. So now it's here, and we're going to really follow it and see what might emerge. And so I just want to give you an example. The American Academy of Birth Centers has some online advocacy, and you can, if this interests you, you can go to their social media websites and you can see that you can put in your zip code and they have a little form. But you might see a lot of this. And part of why does the Midwives for Moms really something that will amplify the good work that's happening in New Jersey? Because this bill comes right, this language on my slide comes right from the bill. it's going to increase evidence-based, culturally congruent maternity care through CNMs, CMs, and CPMs. And most importantly, for that continuity, there's 2 federal funding streams. And this goes into the weeds, but this is how we get midwifery education supported, sustained, and transforming for the next generation. So, the health professional training program and the nursing workforce development programs, I can't say enough about why that is so important for student access and getting federal dollars for midwifery education. So the bill is S 1851 or HR 3768. And so be on the lookout for that. Finally, the second bill I want to amplify for this conversation was reintroduced right around Mother's Day, and it got to committee right on May 15th. And it's called the Black Maternal Health Momnibus of 2023. You may have heard or have seen this infographic previously, because similar to the Midwives for Moms, this is a series of bill that also is not new to the language of maternal health policy, advocacy, and levers. And this bill is defined to end preventable maternal mortality, severe maternal morbidity, and maternal health disparities in the United States and for other purposes. And so this same infographic is updated for this 118th Congress. What's different this time, when this was reintroduced about a month ago, is that now there's 12 standalone titles for the Black Maternal Health Momnibus Act. And I think it's really worth at a future point really learning what these are. But for time, I just want to list them out. And I want to say that Representative Lauren Underwood, who's been the champion and the immediate sponsor from the beginning, also from New Jersey, we have Senator Cory Booker. So there is a lot of important advocacy happening, and this is a comprehensive series. And so I want to just go, where would you get information? Because this one, unlike the Midwives for Moms, which is kind of easy to understand, it's federal funding streams, it's the 3 different midwifery licensures. These are 12 different bills. Luckily, the Century Foundation has a website where you can go and you can track the progress of each of the bills. And so that's just what the screenshot is on the side. And here's just another screenshot. This is so part of the Momnibus is from Senator Markey and Lauren Underwood. So there's a Senate and House co-sponsors, and it's protecting moms and babies against climate change. And you can see how the Century Foundation has an infographic about it and a quick snapshot. You can also, this is the same bill that's being communicated by the Black Maternal Health Caucus. So again, the same bill name, you see the same co-sponsors, and their infographic just kind of tells a little bit about what voters would want to know about it and how this bill in particular is a very important strategy in maternal health equity. One of them I just want to amplify for New Jersey, because we have 3 co-sponsors in New Jersey of these 12 bills, is called the Perinatal Workforce Act. And we have from New Jersey, Donald Payne, Bonnie Watson-Coleman, and Bill Pascrell. And that, again, might be something I'm very interested in this, because as a childbirth educator and doula and someone who works in public policy, I would never do assessment or diagnostic or be in any clinical spaces. But we really want to make sure that the perinatal workforce that has community health workers, doulas, childbirth educators is also funded and supporting. And so that's what this is, one of the pieces of the Momnibus does. And this is just an example of the longer bill. Representative Gwen Moore and Senator Tammy Baldwin are really trying to focus on this, because it would really grow and diversify. And again, including physician assistants. So you're going to get some assessment, some diagnostic, and you're also going to get peer support. This is a great bill. So how do you keep finding out about these? Well, we looked at TCF. In conclusion, I just want to say AMCHIP has a maternal child health bill tracker. They update their bill tracker every so often. And then if you really want to go in the weeds, these are some great organizations that you can follow everywhere from Every Mother Counts has an advocacy toolkit. The National Birth Equity Collaborative has a whole policy part of their website. The National Partnership for Women and Families, Lamaze, March for Moms. I'm leaving 1,000 out, but I just wanted to draw your attention to at least for those, the Midwives for Moms and the Momnibus updated for 2023. These organizations I know already have stuff on their social media about it. So thank you so much. I'm so glad to be here. I work as a consultant to the Burke Foundation, supporting community doulas, and I'll be at Moms Congress and gardening, and I'm really looking forward to continuing this conversation. And these are the resources. So thank you, Harmony.
Great. Thank you so much, Jill, for providing that overview. And just thank you so much for touching on a lot of those important points. We're now going to transition to our Q&A segment. And again, we still have our Jamboard running in the background. So if you'd like to drop any questions on there, please feel free to follow the link that we inserted in our chat box, or you can private message me your questions as well as we get through them. We did already have a question that we are happy to answer. Someone asked if any of these statistics will be made available, and the answer to that is yes. All of the slide decks and presentations will be sent to all of you in our follow-up email. So with that said, we will transition to our first question. Our first question is this. It's probably directed towards Kate in her presentation. How does the state come up with its priorities for the 1115 waiver? And how can health equity champions and advocates play a role in shaping future waivers?
Thanks. Yes, I glossed over it really quickly, but there are a lot of opportunities, both while the state is coming up with their 1115 waiver priorities, and then also just in general to make your voice heard. So I'll drop a link in the chat in a moment, but the state quarterly holds something called a MAC meeting, which is the Medical Assistance Advisory Council, and that's a meeting that's open to the public. And so once a quarter for a 2-hour virtual meeting, and it may at some point go back to being in person, the state really gives an overview of the different programs that they are working on, and there is an advisory council that is able to provide input and ask questions, as well as the audience asking questions as well. So that's a great way to stay up to date with what's going on in Medicaid. They also use that forum and then other public forums to allow people to come and issue testimony or provide feedback or comments regarding the 1115 waiver or other quality improvement projects they're working on. And all of those will be available to know about during what's called a public comment period, which is anywhere from 30 to 60 days. So there's always opportunity to both verbally give your feedback to Medicaid to help shape priorities, and also to submit written feedback. In addition, the federal government also has a public comment period. So even after the state has put together what they believe to be their priorities with the input of health advocates and people working in the healthcare space, the federal government also gives opportunity for people to provide written feedback to them then, and that's also taken into consideration before anything's finalized. So I'll drop a couple of links in the chat on how you can stay up to date with these issues, but first I'd recommend that you attend those MAC meetings. They're really helpful and very informative to give your voice.
Great, thank you so much. And there's also some resources on the chat as well related to an 1115 waiver training. So please feel free to refer to the chat for that as well. Our next question is a little bit more open-ended, and it's directed to any of our speakers as well. What organizations support and advocate for doulas or doula work in general?
I can address that. So, in New Jersey, there's tremendous support for doulas directly from our administration, starting with the inclusion within Medicaid for reimbursement for doula services. But within the Department of Health, there's the Doula Learning Collaborative, which offers all kinds of support, education, guidance with the Medicaid reimbursement process for doulas in the state. So I would refer anyone who's interested to that organization.
Great. Our next question is related to the number of midwives. What do you think is the ideal number of midwives in New Jersey? But is there an intentional number that we should be aiming for?
So I'd love to take a stab at that, and then maybe Ariel or Jill might, or Kate might want to weigh in as well. But I would just draw everyone's attention to the fact that in countries with similar resources to the United States that have vastly better health outcomes for the perinatal population, that there are many, many more midwives, like 80% of regular healthy people who are birthing, who are have no medical complications, are having their births attended by midwives. So in the United States, we are really flipped. And the studies clearly show that if we increase the number of midwives, that maternal health outcomes will increase. That being said, so I think the ideal number right now would just be more. And there's efforts being made to grow and diversify the midwifery workforce. And it all starts with expanding access for people to be educated as midwives. And there was just HRSA funding that was just announced last week that's dedicating $8 million a year over 4 years to midwifery education programs to grow and diversify the midwifery workforce. So certainly this is something that's being looked at nationally, and a big shout out to our administration who did this last year before HRSA announced this and gave the $1 million for midwifery education in New Jersey. I don't know if anyone else wants to weigh in, but again, I would just reiterate the more.
Yeah, everything Julie said. And I want to point out that we have about, I don't know, 450 midwives in New Jersey, registered in New Jersey, but they don't all work in New Jersey. So one of the things we're trying to do is make New Jersey a more friendly place for midwives to work. That's why a lot of this legislation is really important. Midwives don't want to work where we feel that we can't properly take care of our patients and be full advocates for our patients. So we really want to change the culture of birth with legislation and with hospital-based institutional policy so that more midwives want to come to New Jersey and stay in New Jersey.
I'm going to follow up, and Julie, I'm going to borrow your phrase more and everything you said, but and also just really because we have about 10% of women individuals in New Jersey using midwives. Midwives are still othered. And so that requires really a system change and transformation. And so we need to move beyond the binary of OBs versus midwives into integrative, optimal care, where everybody can get the care that they need. But it's really centered in the midwifery model of care globally.
Great, thank you so much to all of you for answering that. Our next question is really directed at the second presentation with Ariel and Jill, focusing on the New Jersey legislation. The question asks, to clarify, the $1 million grant that Governor Murphy granted to midwifery education and access, will it only go to Rutgers students or will it go to all nursing schools?
Could Julie answer that? That was.
Yeah, absolutely. So that money is being used for a number of different things. It's being used for research about midwifery in New Jersey and midwifery nationally and access and barriers to midwifery education. It's being used for a series of workshops for midwives teaching in the clinical setting, and that's opened up all different kinds of midwives and not even just New Jersey midwives. And then there is funding that was directly allocated as well within that grant for increasing access to the midwifery program at Rutgers University. So it's really used for a diverse groups of things. And hopefully we'll see the same with the fiscal year 24 monies, that it'll be used for midwifery across the state in addition to money for Rutgers University.
Great, thank you so much, Julie. And we have time for one more question. This question is a little bit more broad, and I think it's perfect for just thinking of next steps. But how can the people on this call learn more about the legislation that you presented and continue to promote it?
I think that's a great question. You know, if you don't know this about me, my undergraduate degree is social studies and civic education. So I love legislation. I follow it both at the state and national level. And it may be something that we can just send out quarterly updates or as they emerge in terms of keeping everyone, updated, both from state and federal and even local. we have even municipalities that are making sure that there's proclamations for New Jersey Maternal Health Awareness Day, and things like that. So maybe that's a future conversation for using some of the toolkits that are already there, and how do we make it at the municipal, state and national level.
In particular, if people want to know more about the midwifery modernization bill that's coming out and want to become involved in that, please email me directly. We're kind of garnering our resources and support. I'll put my email in the chat, and I will be happy to send updates to anybody and everybody.
Great. Well, thank you so much. And again, all of the contact information for all of our speakers will be sent to you as well if you have any other questions or concerns that you'd like to follow up with them. But with that said, we just wanted to thank all of you for joining today's Policy Spotlight. As a reminder, all of the slide decks will be sent to all of you in a follow-up email. And again, once you leave this meeting, you will be asked to take a very brief exit survey. And that exit survey is just going to assess your knowledge about midwifery after attending this session. And with that said, we'll be sure to connect with you for our future events for midwifery collaboratives and policy spotlights, and we hope to see you there as well.